we realized that we needed to become a provider in health plan networks in order for us to be able to provide this service. Patients that have gone through our care pathway versus those that have not gone through our care pathway have 16 weeks longer breastfeeding duration. It goes back and forth between feeding and sleeping. By the way, those are highly connected. The reason you're not sleeping is because of feeding often.
Yep.
And so this is a whole clinical specialty for those that choose to breastfeed, and we should have the infrastructure to support those that make that choice.
Andrea Ippolito is a biomedical engineer who went from the White House and the VA to building SimpliFed after becoming a mom of two and living the gap in postpartum care herself. 6 years in, she's turned insurance-covered baby feeding support into the front door for 6 years in, she's turned insurance-covered baby feeding support into the front door for a full maternal health platform. Now in network with most major plans, support into the front. Now in network with most major plans, on track to touch 5% of all U.S. births this year, and fresh off an oversubscribed 10.8 million Series A, expanding from lactation into virtual OB care. Andrea Ippolito. Andrea Ippolito is a biomedical engineer who went from the White House and the VA to building SimpliFed after becoming a mom of two and living the gap in postpartum care herself. 6 years in, she's turned insurance-covered baby feeding support into the front door for a full maternal health platform. Now in network with most major plans, on track to touch 5% of all U.S. births this year, and fresh off an oversubscribed 10.8 million Series A, expanding from lactation into virtual OB care. Andrea Ippolito is a biomedical engineer who went from the White House and the VA to building SimpliFed after becoming a mom of two and living the gap in postpartum care herself. 6 years in, she's turned insurance-covered baby feeding support into the front door for a full maternal health platform. Now in network with most major plans, on track to touch 5% of all U.S. births this year, and fresh off an oversubscribed 10.8 million Series A, expanding from lactation into virtual OB care. Andrea, welcome to Reclaim. Andrea Ippolito is a biomedical engineer who went from the White House and the VA to building SimpliFed after becoming a mom of two and living the gap in postpartum care herself. 6 years in, she's turned insurance-covered baby feeding support into the front door for a full maternal health platform. Now in network with most major plans, on track to touch 5% of all U.S. births this year, and fresh off an oversubscribed 10.8 Series A, expanding from lactation into virtual OB care. Andrea, welcome to Reclaim. This episode of Reclaim is brought to you by Future Digital. At Future, we partner with the next generation of category-defining health brands to scale through paid media, lifecycle marketing, and performance creative. If you're building a women's health or family brand, and you're looking for a growth partner who knows your category, visit Scale with Future to start the conversation. Now, let's get into it. Andrea, I've been super excited to have this conversation, to dive into your story and the decisions that have birthed and also built SimpliFed. So welcome to Reclaim.
Thanks so much for having me. Excited to be here.
You know, one of the things I love, especially building in women's health, is that there is such a lived experience component to that. On one hand, you can say, well, that's becoming increasingly common, but I also love that it stems from your own lived experience. And I thought it would be great if we could start there with your origin story and what led to the founding, the birthing, and creation of SimpliFed.
Well, my background is I'm a biomedical engineer by training, and I worked in medical devices. And in graduate school, my research was for the chairman of the Joint Chiefs of Staff at the Pentagon on specifically how to implement and scale telebehavioral health for service members faced with post-traumatic stress. And this was back in 2010, before virtual care was really in the scene. But I saw the power of virtual care to improve access to care, and most importantly, how to really meet patients where they're at. Then, co-founded my first company, sold
Yes.
that to Athena Health, and then fast forward, had my first daughter, and I saw how hard baby feeding was, and I saw how connected it was to my baby's health, my physical health, my mental health. I saw that there was this vacuum of care that was the postpartum experience. You've gone through this major medical procedure of having a baby, and then you get, 6-week visit. If you're lucky, it lasts 10 minutes.
Yes.
And they mainly just talk about birth control, which, that's important, of course. But I've just gone through this crazy, crazy thing of 3D printing a human and all the intensity physical and mental intensity of that. And you just have this one visit. And then I also saw that most parents, were both feeding with breast milk and formula, but yet they were often pitted against each other. And then the last item I saw was mainly on the business side. I saw that under the Affordable Care Act, health plans are required to cover breastfeeding and baby feeding support. But most parents didn't know that. And most health plans, in fairness to them, didn't know that. And it was this not very marketed part of what was underneath the ACA and the requirements underneath the Women's Preventative Service Initiative and United States Preventative Service Task Force Initiative. And so thought there's got to be a better way here to really improve access to care covered by health insurance. And that's what we set out to do with SimpliFed.
Mm. As a mom of two boys, I can relate to all of that. The first experience with breastfeeding, there was so much thrown at you. There was a self-judgment. You were exhausted and expected to learn something that was also supposed to be so intuitive and so natural. And I absolutely get that. So how did you weave your background being a multiple time founder into tackling this problem? Because you're a mom of two. So it's not like you've got all this headspace on and all this time on your hands. So how did you first go about tackling this and making the decision to make this accessible and covered by insurance from the very beginning?
So what we really focused on is that because this is a mandated requirement under the Affordable Care Act, is
Yeah.
we realized that we needed to become a provider in health plan networks in order for us to be able to provide this service. And so what we did is we actually started working with TRICARE beneficiaries and Medicaid beneficiaries first. And as many folks know, about over 40%, actually 44% of all births in this country are covered by Medicaid. And so it is really important that you build your care pathway in line with Medicaid requirements in order for you to be able to support and serve those patients. And so what we did is we made sure to really stand up our infrastructure to be able to support that. So this is in the getting into the weeds a little bit, but I think a lot of founders don't talk about this. Is the first step is one, you have to set up your friendly professional corporation structure alongside your Delaware C Corp or your MSO arrangement. And this allows you to really be in compliance. Secondly, you have to make sure that you can serve Medicaid beneficiaries and you have what's called an MMIS or Medicaid Management Information System number. And that is done at each individual state level. And then once you do that, you have your group provider number and your individual provider numbers within MMIS. And then you can then become in-network providers and apply to become in-network providers. And so that is all the steps that we had to take to really get off the ground. And
Yeah.
then came commercial members. And so I like to always tell other founders that this process can seem very overwhelming, but the rules are actually really, really, really clear. And so as long as you follow the rules and go through stepwise, you too can serve Medicaid beneficiaries, TRICARE beneficiaries, commercial member beneficiaries, but you just need to make sure to follow the rules.
Interesting that it's considered simple, because I can see how that can appear overwhelming and just this maze that one needs to navigate. Were you very clear that you wanted to start out with breastfeeding support and going that narrow, going that niche? Or were there considerations in the beginning around, do we want to try to create more access or offer more services in the beginning?
So our core business to date and in the beginning was very focused on breastfeeding and baby feeding support. And that's what we were
Okay.
laser focused on. And, this is a whole clinical specialty that has
Yes.
reimbursement codes, that has board certified health professionals that, depending on what parent you ask, is either the number one or number two pain point. It
Yes.
goes back and forth between feeding and sleeping. By the way, those are highly connected. The reason you're not sleeping is because of feeding
Mhm.
often.
Yes. Yep.
And so this is a whole clinical specialty for those that choose to breastfeed, and we should have the infrastructure to support those that make that choice. This is an organ that you have not used in this way before. This is a very intense thing. It can be very painful, and it involves two patients, the mom and baby. So there's very few other things, if you think about it, that are that complex.
Yeah.
And it is super complex, and it is a whole clinical specialty that has all this infrastructure that is behind it, but yet it wasn't a central part of the maternal health experience, especially the postpartum experience. And
Yeah.
so that's where we started, because this is such a huge pain point. And like a lot of other women's health founders, women are 51% of the population, but this problem space we're talking about impacts 100% of the people that are born.
Yes.
And
That's right.
this is a huge TAM, a huge business opportunity. This is
Yeah.
not niche. And, we always got asked a question. This feels a very niche.
Yes.
I go to talk to any mom and ask them, is this a niche thing? This is an
Yeah.
all encompassing, no days off, no nights off. And there's
Yeah.
a lot of people spending a lot of money surrounding their postpartum experience, and feeding is a central part of that. And so
Yeah.
what we really did is we wanted to really perfect and be the leaders in our core business of breastfeeding and baby feeding support. And we have a whole 6 appointment care pathway that is informed by all the major medical recommendations put out by American College of Obstetricians, American Academy of Pediatrics, Family Medicine, Academy of Breastfeeding Medicine. And so we have this very, very clinically backed, evidence backed care pathway that we now
Mhm.
actually have clinical study results to prove it. Happy to share more on those. And
Yeah.
we wanted to be the leaders and best in that, so that we became the new standard of care in maternal health.
Yeah. I think maybe niche doesn't fully capture the depth of it and perhaps its focus, right? Because to your point, the support and the market is there. And I personally appreciate how focused it is because you can go so deep.
That's exactly right. And
Yeah.
because it's very focused and deep, it represents this incredibly powerful engagement opportunity with
Yeah.
patients, right? Because, as you were saying with your two boys, this is this all encompassing activity. And so what
Yeah.
we now do is we now do all sorts of other aspects of maternal health, because we have this very trusted relationship with the patients that we have the privilege to serve. And
Yeah.
happy to share more on those.
Well, let's actually talk about the outcomes considering the quality of care that you are delivering. 87% breastfeeding at 3+ months compared to the 69% national average, or maybe you're even holding yourself to a higher bar. But let's talk about the outcomes and the study.
Yeah, well, we are really excited to share some even newer clinical outcomes than that. We're
Okay.
very proud of the one that you just shared. And we had a clinical study where we're almost through, but recently at an pediatric academic research society conference, these results were shared. And it shows that patients that have gone through our care pathway versus those that have not gone through our care pathway have 16 weeks longer breastfeeding duration. Additionally, for a patient that has a mental health diagnosis, for those patients that have that mental health diagnosis that go through a care pathway versus those that do not go through a care pathway and have that diagnosis, our patients feed for 24 weeks breastfeeding duration. And it shows you, and hopefully shows folks, is that you deserve support, especially if you are going through something and you have a mental health diagnosis. You really do need the support. And I know that as a patient on the platform. The other aspect that we're incredibly proud of aligned to that is what the study has shown, is that for patients that have a PHQ-9 score that is higher, PHQ-9 is one of the instruments used to evaluate and assess looking at mental health. for patients that have that higher PHQ-9, when they go through the SimpliFed care pathway versus those that have not, our patients have a lower PHQ-9 score at 6 months postpartum. And this shows and begins to validate, always more study work needed, is that what really we've known all along, but now we have some evidence behind it, is that baby feeding is so connected to mom's mental health. And we had this reproductive psychiatrist tell us that if you could solve baby feeding challenges for our patient population, half of her patient panel would evaporate overnight. And that's how I felt as a patient. And then once I had SimpliFed, I definitely felt so much less stressed. I felt like I had support. I had someone that had my back. I exceeded my baby feeding goals and so much more.
Wow. I'm curious, that raised more of a personal curiosity question. How many moms going through the care pathway are dealing with insufficient milk volume? And does that become a solvable or something that is just a gap and they have to explore other solutions?
This is a great question and a
Yes.
very thoughtful question. And I'm going to share why, is that there is a medical condition where you are not able to produce enough milk.
Yeah.
What's tricky is, and why there needs to be so much more research, I joke, but I'm pretty sure it's true. There's more research funding for cow mastitis than there is human mastitis. And I joke, but like it's a laugh cry situation, right? And the reason I say that in relation to this question is we have so much more to learn. And what we often don't know with that research is there are some studies that show that it's about 5% of moms have that condition that you're talking about, that they aren't able to produce enough milk. What we don't know, though, is what if they were given support? And by the way, what I just said is a very charged topic. I know I had someone tell that to me with my first daughter, and I literally wanted to punch them in the face because then it made me feel bad. It made me feel like, oh, I didn't do enough. I should have gotten support. And so this is one of those topics that's very hard, and there needs to be more research on it. And we do know, though, that a lot of moms aren't getting support, especially covered by their insurance. And that's the part of the research that we want to further understand. If more support was given and the parent chose, that's important to say as well, that they wanted to breastfeed and wanted to move forward, what would those numbers look like? Would it be more or less, et cetera?
Yes, yes. And that's something that I've always wondered myself with the virtual care support that is emerging in the last years. Will that change the outcomes, with education, with nurturing? And so that's something I've been curious about. I think based on our research with SimpliFed's growth, you're on track to reach 5% of births. Is that accurate? I mean, that's a big number.
Yes. This year, we are on track to receive referrals from 5% of all pregnancies in the U.S.
Wow, that's a huge milestone.
Yes, we're very excited and it's very proud. And, first daughter was inspiration and third daughter and I are patients. And so I'm pretty charged up and to accomplish that because I know the impact it can have on patients.
Yes. And I guess tied to that, and I think I'm just asking this from a consumer marketing standpoint, you've always gone in network and going through the pay or reimburse model. Is there consideration around going direct to consumer? Is it not necessary given your expanding reach? I'm curious as to what the thoughts and considerations around that is.
Yeah. Thanks so much for this question. So you can think of our model as like we've had to kind of build things in parallel. And one, I would say there's 3 legs to that. One is we need to build our care delivery pathway backed by evidence, build our curated network of providers, train them up, recruit them, make sure that they're aligned with our values and mission. We need to have the underlying operating system and technology platform that we can serve patients and support patients, measure data and outcomes, make sure that have high quality standards, et cetera. So that's the first leg. Second leg is becoming an in-network provider and obtaining commercial Medicaid and TRICARE health plan contracts. We've talked about that. The third leg is the kind of distribution of how do people find out about us. And we've taken a strong point of view in years past of we want to meet families where they're at. And how do you meet families they're at? Well, you have to be connected to pathways that they are already receiving maternal health care services. So what we've spent a lot of time is working with OB practices across the country, healthcare systems, other strategic partners where we get embedded as part of prenatal order set templates in electronic medical records. And I saw a recent article and some other podcasts have highlighted this as well, is that especially in the world of AI products, there's really not very much product innovation right now. And we can debate that to the cows come home, but there's some, truth to it. But where you need to really be building your moat is distribution. And that's what we've invested a lot in the last few years, is getting embedded as part of OB care pathway workflows so that when a patient reaches that 28-week prenatal visit, and for those that remember, that's typically when you do that gross glucose chug, and it's always a fun experience. So what happens after that visit is the OB will refer to us. And then we then proactively reach out to the patient with something like, "Hi, Andrea, Dr. Ippolito has referred you to us from Ithaca OB-GYN, whatever your practice is. Let's get you set up for your prenatal baby feeding appointment." And then that sets off our care experience and journey, where we do 1 to 2 prenatal appointments. These last 30 to 60 minutes. We set expectations on what baby feeding looks like. Of course, we answer any questions. We have specific care plans that we cover at each visit. And then after baby's born, we continue working with them in this ongoing longitudinal way to navigate all the twists and turns of feeding. And then we're sharing notes back with the OBs that we collaborate with that have referred to us. So that is how we've grown to date, along with other partnerships. But now we have much stronger health plan coverage, and just, we have much more of a scalable system and platform. So we are starting to think about ways that we can go more direct to consumer, but a large percent of our patients are still coming to us organically via word of mouth or finding us online. So we're really starting to grow that side of it, but we haven't invested in a lot of, I would say, D2C channels to date, but it's something we're exploring.
Interesting, because I do wonder if building up that brand awareness and building up your awareness in this category would also infuse between referrals and also them just asking their OBs about it. But something to consider. Well, you've had a fairly recent Series A raise, and I'm curious if you want to go into what the intended growth is and plans for what's next. The American Medical Association is unbundling the global maternity reimbursement code starting in 2027. So just kind of wondering how you're also thinking about that with the different categories of care being billed separately.
Yeah. So there's always, people always talk about things very dramatically, right? This is a transformational step. So I hate to say it, but I'm going to really lean into it. This is an incredible, tectonic shifting step that's happening right now in maternal health. So just to provide a little bit of background so I can express how awesome, exciting this is, again, debated, and I think it's important to call that out, is previously, or still currently until, like you said, Jan 1 of 27, all of the prenatal postpartum care, labor and delivery was in one, what was called global payment. So all those 10 to 15 prenatal visits, the labor and delivery, and then any postpartum care was in one payment. And that payment definitely, there were some variations, whether it was a vaginal birth or a C-section, but in general, one global payment. And it was well intended, right? The idea was, let's make sure these are the standards for this maternal health care experience. But the reality of the situation is that once you got through the birth, and because OB who are doing a Herculean amount of tasks, we need to be bowing down and clapping. There should be a parade every day for OBs and midwives out there, because they are just operating under intense stress, all hours, on call, having to go into the hospital, which, they, train so hard to do. They're the experts. They're so, mission driven. there is less and less OBs going to the field. That puts more strain into the system. So rightfully so, once you get to the postpartum, they just didn't have capacity to provide postpartum care. And that's why a lot of parents felt like how I felt, where holy moly, like I just had this crazy medical procedure and I feel like I should be getting a lot more care here. And I'm just struggle city here. And so what this unbundling is, it allows OBs, midwives, maternal health providers to be able to bill fee for service for all the different aspects of the care. And this is an interesting step in a world there value-based care is talked a lot about, and we can debate also like whether this is the right move or not, but the reality is the outcomes speak for themselves. Is preeclampsia rates have doubled in the last decade. Maternal mental health rates have doubled in the last decade. Maternal health outcomes are arguably worse than our parents' generation. So the current reimbursement model isn't working. And we could spend time designing it in to do what it was intended to do. But this feels like the right step to actually incentivize care. And we know that more broadly, not in maternal health is one part of women's health care, that women's health is reimbursed a lot less than men's when you do look on any peer-reviewed evidence study on the matter. And maternal health is a great example of this. And so we need to be surging support of these services. And the part that I'm most excited about is the postpartum care side, because this will allow OBs, midwives to be able to deliver more postpartum care. And the way that this was designed, they shared at the recent American College of Obstetricians guidance, is that it's designed to be budget neutral on an RVU basis. And so it's designed to be sustainable for health plans. It's designed to be sustainable for OBs, but being able to get paid for the care they're delivering and at the right moments. And so there's a lot there that I'm happy to speak to, but this is a huge step that's taking place right now in maternal health. And so patients should be aware that this is happening because you deserve access to insurance covered postpartum care.
Yes, 100%. I'm so excited about this for my friends who are having babies or about to have babies and our growing community around that. And so I guess with the timing of your recent close, how are you thinking about what's next for SimpliFed and where to grow into virtual OB care in terms of what's next?
So what's next for us is, as we make this evolution from virtual breastfeeding and baby feeding support to this virtual OB/maternal health care, is that we will continue to serve as an extension of OB's healthcare systems and other partners we support, and really leveraging this core relationship that we have surrounding baby feeding support, where we have a very trusted relationship. And because our patients really trust us, we support them, we meet with them for 30 to 60 minutes, they feel comfortable sharing other aspects of things that are going on. We do maternal mental health screeners, and then we connect them to insurance covered care. We do social determinants of health screening so that we can make sure they're connected to the resources they need to be effective. We are starting to do sleep screeners, which is so connected to mom's mental health. There's validated instruments out there, and to really understand how that's going and how we can troubleshoot. And then we're doing assessments on other high risk or rising risk issues, and then education surrounding them. And, a good example is with my first daughter, I was 34 years old, so right at that cusp of that advanced maternal age, but, I was otherwise very healthy, had no cardiovascular issues, and I had preeclampsia. There's not an OB, on paper that would see and be like, you know what, Andrea is high risk for preeclampsia, but I was. And so what we're doing is educating patients on the risk factors to look out for things like preeclampsia, things like gestational diabetes, things like anemia. My second daughter, I had anemia and postpartum, and I was so fatigued. Like oh my goodness, I couldn't drink. I could drink gallons of water and it wouldn't satiate. And everyone was just saying, "Oh, that's typical because you're breastfeeding. Oh, that's typical. I was so fatigued. It's because you're a new mom." I'm like, no. I know what tired is. This is fatigued. And turns out I had anemia, had to get massive iron IV infusions. So we're educating patients of warning signs along with assessing for these, and then being able to connect them to care, whether that's back to their OB or to a specialist. Postpartum recovery. we know that pelvic floor issues are so important. So making sure that we're educating patients on that. We're not trying to be pelvic floor providers, but then connecting them to those needed expert maternal resources, which are covered by insurance. So we're leveraging this chassis of a relationship we have to identify issues and then refer as needed.
I love that you are creating deeper trust points along the way. And what I'm also hearing is that you're extending the journey in terms of what you're supporting. Because I'm curious, as of now, how long on average are you supporting a patient or a mom versus now lengthening the journey itself?
So we start working with families at 28 weeks. Sometimes they get referred to us earlier. So at the beginning of that third trimester, and then we support them up to a year postpartum. And then the average patient will work with us for 6 visits. So some of those, as you can imagine, in those early postpartum days, we tend to be seeing them more frequently. But the key thing is postpartum, we really meet families where they're at as you're about to transition back to work. We know that's a major milestone, a major stress point as well. And so 3 weeks ahead of that, 2 weeks ahead of that, 1 week, whatever works for that parent, we're then making a plan. The transition to complementary foods, transitions during different growth milestones. Whatever those milestones, as part of our care pathway, we're proactively reaching out to patients, getting them scheduled to prepare. Even if things are going great, that's when we like to proactively address. Our care pathway is a preventative service. We are serving things acutely and urgently as needed. But the reason this is a mandated service on the Affordable Care Act is because it is deemed preventative under the Women's Preventative Service Initiative and the United States Preventative Service Task Force. So even if things are going great, we work with patients to educate, prepare what's to come. And we know that's not just philanthropy. We know that has strong return on investment, because that patients that have a cardiovascular issue, especially those that don't get identified earlier, are depending on what cardiovascular condition, 2 to 5 times more likely within 5 years to have a cardiovascular issue. We know that patients that have gestational diabetes, especially that is not supported and managed and treated, are much more likely to have diabetes that can come up. We know that patients that have symptoms of anemia, and I'm one of them, that actually it could be an early symptom of an autoimmune disorder. And that's what happened with me with my anemia. And so pregnancy and postpartum is a giant physiological stress test and on the body. And it actually unearths, and there's a lot of evidence behind this, some early warning symptoms and signals of what's to come. It's a preview of what's to come. So if we could actually better listen and monitor and identify these symptoms early, we could better understand. And the last thing I'll say, just related to what I said, is my anemia was an early signal of ulcerative colitis. And because of that, and because I was able to get ahead of it early, there are things you can do, not always, to help alleviate what's to come early. So this is a major return on investment. It's good for clinical outcomes. It's good for moms' physical and mental health. And so that's exactly what we're working towards.
I love that you're going deeper into catching the signals and, as you say, listening earlier. I had preeclampsia with both pregnancies, and the first time was completely unexpected. The second time, we did our best to monitor, but still wasn't quite picking up on it until the very end. So from a mom and from a patient perspective, I mean, I think it's so needed. Yeah.
Oh, well, I'm
Yeah.
sorry that you went through that, and it's devastating and it's complex. So thank you for sharing.
Oh, yes. My goodness. It was quite a journey. Maybe switching gears for just a few moments before we end with the last question, which is around, what you're helping your customers reclaim and your patients reclaim. You're a multiple time founder, and I'm always curious around the founder instinct. And for you, has it always been a natural evolution to be a founder? Did you really think about it? Any childhood influences that led to this journey? Because it's such a big thing and a rewarding thing that you've taken on as a mom, as a woman. And so I'm always curious about that.
Yeah. So I was always excited about entrepreneurship. I took all the classes on undergrad and grad school, but inherently I'm a builder. And, I always like to say my grandparents, one of my grandparents was a small business owner that loved to, play the slots and lottery and, got in some trouble with that at times too, as always, but he was a small business owner. And then, my other father was a lawyer. And so I like to say between the two of them, I'm a health tech entrepreneur, right? Because you got to, push things forward, challenge the status quo, but you got to do so legally and ethically, compliantly. This is healthcare after all. And so
Yeah.
I always say it was in my DNA from that sense and, had that kind of grit always from the beginning. And, but I'm an engineer and I love to build and solve and make mistakes along the way, of course, and learn from them. But when you look at my career, there's just all these examples of just building networks and systems. And so whether that was building the Innovators Network at the Department of Veterans Affairs, I was a big part of this group at MIT called Hacking Medicine, where we put on these hackathons and built this community there or starting a couple companies here and there. And so I just always been that entrepreneur and with SimpliFed, this was a personal pain point that I could not solve. Right. And yeah, I just had to do it. I was obsessed with it. I really tried to understand the space. I really was excited to learn more about all the science and evidence behind it. I have, I enrolled my daughters in all these microbiome studies because I was so intrigued to understand the implications of food. When you're an entrepreneur, you become obsessed with the space and the policies and what have you. And so I would say that has always been there. But I always like to say to folks that it doesn't happen overnight. I think there's this narrative out there that founders have an idea and then they quit their job. For me, it, really took, in and around my second kid to really think about, wow, I really got to go solve this. And then, as we've talked about, I'm very proud to say that my third daughter and I are patients on the platform. And we've really built this platform with patient needs in mind. And when I was going through the care pathway, I was always taking videos and just, this is the patient experience. And I think that's why we need more female founders out there, especially building in women's health.
Yes, I so appreciate that. I love that. And I guess last question is, with this podcast being called Reclaim, what are you helping your patients reclaim in this process?
So every month we have an all hands, and one of my favorite things is to ping one of our team members, hey, what are some of your favorite testimonials? By the way, good and bad, it's important to hear the critiques as well, and we need to get better always. But if I had to pick the most common word that patients use in our testimonials, they are, my provider validated me, or I felt validated. I felt like, and essentially what they're saying is that they haven't been listened to. They haven't had that support. And then second word that is most commonly used is confidence, is you've built my confidence. And those are, hand in hand, because we're working with patients, we're understanding their needs, we're with them when they're in that toe curling pain. If you know, right? And they actually are listened to and supported, and we are the infrastructure they can go to when they need it. And, or as we talked a lot about, we are hopefully anticipating or proactively preparing for what's to come, so that when they hit that moment, they have built that confidence, or they know to say, okay, I need to go get more supportive at this moment, or I've built that muscle memory mentally and physically to handle the situation.
Love that. Love that so much. Andrea, thank you so much for being on the show. I love this conversation from a work and personal standpoint, and I can't wait to share it with our community.
Oh, well, thank you so much for having me. Appreciate all that you do, and come check us out at simplifed.com.